welcome. I am Lucinda Curran, your host for the Environmental Sensitivities Symposium, a world first event. And today I have the pleasure of introducing you to Dr. Leesa Payne. Hi Leesa, how are you?
Hi Lucinda, I'm good, thank you.
Tell us about the work that you do, please.
My area of real interest is helping people to shrink their stress. So I'm a chiropractor as well as an applied kinesiologist, so I use both of those modalities together. I help people to be more focused, calmer and cope more effectively. And I use a variety of techniques, but the main one we're probably going to chat about today is neuro-emotional technique, or NET. People often say to me, what is kinesiology? And kinesiology is a form of manual muscle testing which evaluates the body's involuntary response to a physical or auditory stimulus. And in other words, it's a reflex response of the body to either touch or sound that can identify areas of imbalance or concern in the body. And neuro-emotional technique, or NET, is a mind-body technique that finds and removes neurological imbalances related to the physiology of unresolved stress patterns. So in other words, NET is a stress reduction technique that helps your body release unhealthy stress that it's holding on a physical level.
It's incredible that you started as a chiropractor, yet you're working in this way. Could you tell us how that came about?
Well, first of all, how I became a chiropractor. I started seeing a chiropractor myself when I was 8 years old. My mum has always been a chiropractic patient, and he was a massive inspiration for me. But it wasn't until I was 30 that I decided to take a bit of a leap of faith and go back to university to become a chiropractor. But I've become, over the time since I graduated, more interested in working more with the stress and the emotional side of things, because I've just found with my patients that it makes a huge difference to the recovery for them. It just seems to help their body to be able to heal itself more effectively when we look at all of the sides of the triangle of health, if you want to call it, which is always that structural, chemical, emotional. So I try and look at all of that, and I've just found that the emotional is such a really integral part of everything else that's going on.
How did you actually realise that that was the significant part? Because I guess what I'm imagining is people are coming in for treatment after treatment. Things are sort of either responding or recurring, or they're not responding as you expected. So how did you work out the emotional side was key?
Well, I'd had this sort of treatment from my chiropractor previously, and then I think probably one of the main things was seeing patients who had injuries that had come from, say, like a physical trauma, like a car accident, but that they had a lot of pain that wasn't necessarily directly related to the injuries that they had had. And so I found that by clearing some of the emotional stress around the actual accident itself more than the physical injuries, that seemed to help the physical injuries to reduce as well. And so that was probably one of the main ones where it's a really obvious change.
It's just really lovely to hear the way that the body interacts within itself, so it isn't just one of those areas, but it's all integrated, and that you're actually able to work in each of the different ways by using the different modalities that you've learned.
Yeah, it's a really good way just to make sure that you're hitting most of the spots. No modality does everything, but I feel like this gives me just the ability to really work out what the main issue is for the patient. And it's not always an emotional issue. Quite often it can just be physical, but it's good to have this extra tool in the tool bag that you can bring to the table when there is other things going on.
Why are you so passionate about the work that you do?
I think because so often people carry around a lot of stuff and it doesn't really serve any purpose, and it can be really hard to let go of. And people sometimes don't realise how much that affects their health and the quality of their life. And so if I can be part of helping them to sort of let go and make positive changes, then I feel like that's something amazing, and that's a really positive influence in the world.
And so why do some effects stay with us for years after the fact?
Well, I think the thing to really remember is that emotions are hardwired in our body. So they're a completely normal part of us, and that they're supposed to be there. But we're programmed to respond to a stimulus and then return to normal, or homeostasis, which is the big scientific word for normal in our body. But occasionally, emotional trauma can occur in the presence of a deficit of our body's neurological or energetic system, so the meridian system, and that can cause a pathophysiological pattern in the body that cannot resolve itself. So I used a lot of big words there. In other words, our body is already in a vulnerable state and it's not able to resolve the emotional response in a way that it normally does. And so for whatever reason then, the body holds that emotional state and it can't release it how it normally does, because we have lots of things happen to us in our lives. We go through many emotions throughout the day, and most of the time we react and we go back to normal. But for some reason, sometimes we react and our body doesn't go back to that normal state. So it holds that particular emotional response in a holding pattern.
So what's the most rewarding part about helping patients in this way?
I think for me, it's when they come back after a session and say, look, I actually felt a change. I felt a change in the way I was thinking about that person, thinking about that situation, those sorts of things. And it was a positive event for them in that they weren't holding the same stress levels that they were, or they just felt a different balance about something. So whether they had someone who, I have to be fairly